Everyone desires to nurture a child, but due to circumstances, the wish will not just come through. Today on Sound Health, we are looking at surrogacy, an alternative to motherhood. I'm Olasumbo Modupe. Welcome to the show. On 27th of February 2020, the first case of COVID-19 was confirmed in Nigeria. The Ministry of Health in Lagos State reported that an Italian arrived in Nigeria on 25th of February from Milan, Italy for a brief business visit. He fell ill on 26th February and was transferred to Lagos State's biosecurity facilities for isolation and testing, where COVID-19 infection was confirmed by the virology laboratory. The patient is clinically stable with no serious symptoms and is being managed at the Infectious Disease Hospital in Yaba, Lagos. The good news is that effort is ongoing to identify contacts of the patient since he arrived in Nigeria.
The patient remains in strict isolation at our containment facility in Yaba, and he's doing well under supportive therapy. As of now, we've started to trace the movement of this traveler from the airport through Lagos to Ogun State. And we're busy identifying any possible person that may have come in contact with him so that we can start our isolation and containment exercise to ensure that we break the cycle of transmission.
The government of Lagos State, under the governor as the COVID-19 incident commander through the Lagos State Ministry of Health, has been strengthening measures to ensure that any outbreak in Lagos is controlled and contained quickly in collaboration with the multi-sectoral coronavirus preparedness group led by the Nigerian Center for Disease Control (NCDC). Since the development, the State Emergency Operations Center has been immediately activated to respond to this case and implement firm control measures. Experts say most people who become infected may experience only a mild illness and recover easily, but it can be more severe in others, particularly the elderly and persons with other underlying chronic illnesses. Residents have also been urged to maintain hand and respiratory hygiene to protect themselves and others, including their own families. Following these precautions, regularly and thoroughly wash your hands with soap and water and use alcohol-based hand sanitizer. Maintain at least 1.5 meters or 5 feet distance between you and anyone who is coughing or sneezing. People coughing persistently or sneezing should stay indoors or keep a social distance but not mix with the crowd. Ensure that you and people around you follow good respiratory hygiene by covering mouth and noses with a handkerchief or tissue while sneezing or coughing. You can also sneeze or cough into your sleeve at the bent elbow and dispose of the used tissue immediately. Stay indoors if you feel unwell with symptoms such as fever, cough, and difficulty in breathing. Please call Lagos State Emergency Hotlines 002-316-9485 or 003-356-5529, 005-281-7243. Stay informed on the latest developments about COVID-19 through official channels on TV and radio, the social media including the Lagos State Ministry of Health, NCDC, and Federal Ministry of Health. It will be recalled that the coronavirus was first reported in Wuhan City in China December 2019 and has spread to more than 50 countries. In recent times, 2 in 5 couples are trying for babies. This period could be demoralizing for such families. Today on Sound Health, we are looking at surrogacy, and Mrs. Tola Ajayi, a relationship, sex and fertility counselor with the Nordica Fertility Center, would dispel some myths and misconceptions about surrogacy. Welcome to the show.
Thank you for having me, and good afternoon.
Okay, as a fertility advocate, can you please give us insight into the sad trend of infertility in the society?
Infertility, as we all know, it's inability to have a child, to conceive within a year of getting married, within 1 year of getting married, or 1 year of regular intercourse without any form of protection. That's infertility, and it's a common trend. It is very common. We say 1 in 10 will be infertile. So it is a common trend.
The good news is that despite infertility, there are options to follow through. Can you please take us through some of the options? I know there is IVF.
The first thing I would like to say is, I mentioned 1 year of regular intercourse. The first thing is, the moment you are married and you've been trying to have a baby for 1 year, you've been having sex for 1 year, regular sex for 1 year, and you are not getting pregnant, and you are up to 35 years for 1 year. If you're above 35 years, just 6 months is just enough for you. The first thing is to seek help. To seek help. See a doctor. Let the doctor evaluate the husband and the wife and see whether there are challenges. Because without that, you won't know whether there are problems. And you see people staying at home for many years before they seek help. And that's really something that we are talking, to people about, the awareness. And of course, once the diagnosis is made, and sometimes they may not even see anything in the real sense of it, which is say it's unexplained infertility. But once there is a diagnosis, then we can decide on what type of treatment is suitable for each person, because we know that there are different causes of infertility. It could be from the male, it could be from the woman. So we need to know what the cause of the infertility is for us to be able to advise on the type of treatment to have. The easiest one most of the time is artificial insemination, that people know as artificial insemination, but it's intrauterine insemination, in which we collect the husband's sperm and we introduce into the woman's vagina at the time of ovulation with the use of some drugs. That's intrauterine insemination. And of course the IVF, the regular IVF. IVF also has its variety on different things that can be done with IVF, because if it's a male factor, we need to focus on the man, even though they are doing IVF. And if it's a female factor, also we need to focus on the woman. And so apart from IVF, apart from intrauterine insemination, another option is surrogacy. The IVF also has variety, like I said. For instance, if a woman is using her own egg, the treatment is different from someone using donor egg. And also for the man using donor sperm, as the case may be. And also the option of surrogacy.
As an expert, take us through the procedure of surrogacy.
Surrogacy is, it's referred to as alternative motherhood. And this is for people who are unable to carry pregnancy on their own. For some reasons, some people cannot carry pregnancy. Either the uterus has been removed, or maybe for health reasons, for some medical reasons, like you have severe hypertension, severe diabetes that can make carrying a baby, injurious to your health. So you're advised to use a surrogate to carry your baby. And also we can refer to surrogacy as renting a womb. That's, to rent a womb, to ask someone to carry a baby for you, not necessarily using our own eggs, or just to use our uterus to carry a baby for you. That's surrogacy.
How aware are we in this part of the world when you talk about surrogacy?
Surrogacy is still not, people are not really aware. People are not really aware, but some people are getting to know about it, especially in this part of the world. People have been doing it, people have been using others to carry pregnancy for them. So we are creating that awareness to know that, okay, you can use this method if you have some problems. And we also have some women that says, okay, because of my career, I'm unable to carry pregnancy for myself. I need someone to carry for me. And so the awareness is not where it's supposed to be. It's just for few privileged ones who know about it.
I understand there is a traditional surrogacy, and kindly share with us what type is this method, and let's start with that.
Yes, in surrogacy there are two types. You have the traditional surrogacy and you have the gestational surrogacy. The traditional surrogacy means that the carrier has some genetic factor. That means you are using our own egg. So most of the time in traditional surrogacy, it's not IVF that is being done unless there are other issues. In traditional surrogacy, it means that the husband's sperm, you know, there is a couple, husband and wife, then there is a surrogate. The husband's sperm will be inseminated into the surrogate's via the vagina to the uterus, you know, when she's ovulating. So she's actually using her own eggs. So there is a genetic component to that. So the baby belongs to her and the commissioning father. That's a traditional surrogacy. The other one is the gestational surrogacy, in which case the surrogate does not have any genetic factor. You are just renting a womb. So the egg will be from the commissioning mother and the sperm from the commissioning father, or they may use donor gametes for someone to carry for them. So she's just carrying, no genetic factor at all.
Okay. Why would I want to settle for traditional surrogacy and not gestational surrogacy?
Well, people have their differences, they have options. In traditional surrogacy, for instance, maybe, I don't know, sometimes it's an agreement between the husband and the wife. That's okay, let's use this person so that we know the person's eggs. That is in the case where maybe the wife is supposed to use a donor egg, for instance. You understand what I mean? She's supposed to use a donor egg, and they prefer to use someone's egg that they know, that we know the family, we know the background. So they decide to use that person, and it's going to be the husband's sperm.
What are the vital information I need to equip myself with if I'm choosing surrogacy?
Well, the most important thing in surrogacy, I think it's counseling. Everybody needs counseling. The commissioning couple, that is the intended parents, and the surrogate. Okay. If the surrogate is married, he also needs counseling, the husband needs counseling. So everybody must understand the process. They must understand what it means, what they are going through. Because it's not just enough to say, I'm carrying a baby for you. You are getting pregnant, you'll be pregnant for 9 months. You are going to have a baby, whether you are going to have a baby naturally or you are going to have a baby by cesarean section. You must be prepared. When you are pregnant and the baby is not yours, you want to stay in your father's house or in your husband's house. How do you explain to your other children that you are pregnant and you are coming back home without a baby? How do you tell your neighbors that, oh, she was pregnant for 9 months, she just went away, she came back without a baby? What do you tell them? So you must be prepared. Then for the commissioning couple also, they need to understand what it is to use surrogate. You are not pregnant. Nobody saw you pregnant, and suddenly you arrived home with a baby. How do you cope with that? When the baby is an adult, do you want to disclose to the baby that you use surrogates? Do you understand? So all these things, they need to understand. They need to understand before going into it.
Apart from counseling, what is the next key thing to do? Are there tests to run?
We apart from the test for the couple, you know that when you have done tests for them, you know, okay, this is why they are opting for surrogacy. Because the woman, especially the intending mother, maybe her uterus is not suitable. So she needs someone to help her to carry the pregnancy. either using her own eggs, depending on her age, or using a donor egg, for instance. So we need to assess them. You assess the couple, you assess if she's using her own eggs, you need to be sure that everything is okay with her. She has good hormones, there are no infection whatsoever, maybe HIV, hepatitis and all that. And also the commissioning father, you have to assess the man to be sure that everything is okay. Because you don't want to put the surrogate's life at risk to transmit HIV, especially to the surrogate. The surrogate also, you need to assess her, check her uterus to be sure that she can carry pregnancy, do the infectious screening test to be sure that she's okay too and she's not passing any infection to the unborn child. So there are tests to be done. You need to be sure that she can carry pregnancy to term. So our previous obstetric history is very important. Have you had children before? How did you have them? Was it by CS? Was the pregnancy turbulent? Did you have any challenges when you were pregnant? And these are the things that you need to know, because if it's someone that she gets to, for instance, 3 months, and she has a miscarriage, maybe she has had that once or twice, you know that there may be problems with the cervix. You don't want to use such a person. So these are the things that you look out for to be sure that everything is okay. And one other thing is law. Use of a lawyer to, to talk to both parties, to sign consents, and to know that, okay, we are legally binded, that this is what I'm doing for you. So when the baby arrives, I'm handing the baby over to you because I don't have claim on the baby.
Please share with us, is there an age limit to surrogacy?
Well, adult age from 21 in Nigeria, 21 to maybe 42, 45, if she's okay, if medically she's okay, physically everything is okay, yeah, 21 to 45, you can be a surrogate.
Is it legal in Nigeria? Are there laws backing the process? In your previous response, you pointed out that at times you need to involve lawyers.
Yes, there are no laws as of today. No laws as of today. But in my clinic, we employ the services of a lawyer in whatever we're doing. So the commissioning couple, the surrogate, and if the surrogate is married, the husband also will be involved. So everybody signs an agreement to say, this is what we're doing. So tomorrow, nobody's going to come back to say, oh, I was not told, I was not informed. So the process is explained, you know what you're going through, no one is coercing you to do anything, you agree to the terms, everyone is happy, and yeah.
What are some of the issues surrounding surrogacy?
Surrogates may sometimes, they may not cooperate because suddenly it occurred to her that, oh, 9 months, I'm going to be like at the mercy of someone. So sometimes they may not want to cooperate. And what happens is, most times what we tell the commissioning couple is, take care of them, be good to them. So once that is done, usually when you are good to someone, it's unlikely that that person will turn back unless she's an animal. And which most times by the time you have been talking to them, you will see some traits that you think, oh, this one, she's not going to be a good surrogate. So the commissioning couple usually are being told to be nice to them, extra nice, because they are doing you, a service and a favor. So you must be nice to them. In some instances, some people have reported, we have not seen that the surrogate will carry the baby away. But in Nigeria, I don't think that's going to happen as such, because nobody wants to take anybody's responsibility. We all have enough. Even if sometimes, even the 2 or 3 that you have, if possible, you want someone to come and adopt them for a while and take care of them. Maybe not in Nigeria, and also, some people may want to use that as a blackmail. So that's why it's important to involve the lawyers.
So what if, let's assume, what if that happens? How do you plan to resolve that? What if the unexpected happens?
Like I said, there are a series of counseling. And what we do from the beginning, the surrogate understands what she's going in for. It's not just one appointment. She's been coming to the clinic, we talk to her, she understands, she meets with the commissioning couple, she meets with the lawyer. So it's a process. So she knows. We've not had that type of experience. Because we let them know you are doing, apart from maybe money is exchanging hand, you are doing someone a favor. And when it comes to that, Nigerians, we are very passionate about some things that, okay, I can help. For instance, if not my age, I can carry pregnancy for someone. Really, I can carry pregnancy for someone if not my age, because I know what it means for someone not to have a child. And if that's an option, yeah, people will gladly do it, even though money will exchange her, because you need to take care of them, you need to provide accommodation, you need to, for the meal, for going to the clinic when she's going for antenatal or something. So once you have taken good care of them, I don't see why they need to go back and be nasty.
Surrogacy being fathers, because I understand that they also need to, supply their own semen and all that. Is there anything like surrogacy in fatherhood?
There's nothing like surrogacy in fatherhood, because what surrogate means is rent a womb. In father's cases, we are not renting any womb, but there could be another one, maybe that's what you're referring to, use of donor sperm. If the man's sperm cannot fertilize eggs, or the man does not have sperm cells at all, we may need to use a donor, someone donating sperm for the father. So in this case, it may be, there are different ways that surrogacy can come up. It may be a donor sperm with a woman's egg, it may be the man's sperm and the woman's egg, or the man's sperm and a donor egg, but someone is now carrying for them. So there could be reasons, but if it's just for donor sperm, then the woman can carry. If it's just sperm, the wife can carry the pregnancy if nothing is wrong with the woman.
Thank you so much for the clarification. As we wrap up this segment, what advice do you have for families trying for babies?
Like I said when we started this program, I said the first thing is to seek for help. What I see people do is they go to church and they're in church for years praying. Nobody is saying you should not pray. I'm a Christian, I pray, I believe in miracles. While you are doing that, please see the doctor. Let them run tests. Let the doctors diagnose what the problem is. Because if there's no sperm cells and you are praying, you know what came to my mind that I should say, Omo, you're on your own. Honestly, you can pray, but act. So see a doctor and let them diagnose and advise you on what to do. In some instances, it may just be a procedure that you need. We've had cases where people come in and because they're unable to get pregnant, we do hysteroscopy, look into the uterus, you find some fibroids in the lining of the uterus, you remove it, she gets pregnant. And everything is fine. You understand? It may just be that, okay, use this particular drug and you'll be okay. But if you need to take a decision, if your doctor advises IVF, please do it early. What we see is that people come to the hospital too late. You've been married for 2 years, 3 years, you are still praying, you are still hoping, and you have not done anything. I'm sometimes amazed when people come to the clinic and says, I've not done any test. I've been married for 5 years. I'm like, it's almost like I should take a cane and just bring your pump. Let me, in this modern day age, see the doctor, let the doctor tell you what to do. It's a different thing if you don't have money. You can plan towards what you want to do, but have the knowledge, know that this is what you need, then you can plan towards it. But without that knowledge, you are just there, going to church or visiting all sorts of herbal mixtures, and all that. It's not going to help. I I belong to so many, I joined so many groups on Facebook, and the things I see there, honestly, it's so sad that people refuse to read. People refuse to know what is suitable for them. You see people telling each other, go and take a bicarbonate of soda with banana and with milk and you will get pregnant. Oh dear. Your tubes are blocked. Someone is telling you to take bicarbonate of soda. How is that going to help you? Your tubes are blocked. If you release egg during your ovulation, your husband's sperm is good and he releases the sperm into your vagina via the cervix into the uterus. The egg and the sperm will not meet because the tubes are blocked. So if you take bicarbonate of soda from morning till evening till tomorrow, it's not going to work. So we need people to know awareness. What is available? What can you do? See a doctor. Diagnosis is made. What do I need to do? Work towards that. That's the most important thing. So there are options for people to have a child for themselves.
Information is key.
Very, very key.
We seek medical help early enough to beat infertility. Thank you so much, madam, for sharing your expertise on surrogacy.
Thank you for having me.
Yes, that has been Mrs. Tola Ajayi, a fertility, sex and relationship counselor with the Nordica Fertility Center on surrogacy, an alternative to motherhood. This episode is dedicated to families trying for babies. Sound Health continues with trending and home essentials. Please stay with us. Are you trying for a baby? Why not see surrogacy as your alternative to motherhood? This is why we say thank you on today's episode of Sound Health. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at TLTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.